So when you see something like this on NCLEX in a case study, you get a list of laboratory values immediately. What to concern you? What two laboratory values are you like, something is irregular? And remember, you're going to get the normal range values. So just identifying what is abnormal, that's just step one. So you see which two? The sodium is abnormal and the potassium is also abnormal, right? Now let me ask you this. Which one do you need to call the doctor about first? What is going to be your priority? Is sodium more insignificant, low sodium, or high potassium? Everybody should be saying, Professor Regina, high potassium. Need to call the doctor about that potassium, because your potassium level can be deadly. It's related to your cardiac function, right? Now, say you have a 54-year-old patient. She's a female, history of hypertension, anxiety, and the doctor looks at this and he says, okay, give the patient regular insulin. Patient's not diabetic. Patient's not diabetic. What is the regular insulin going to do for this patient? Think about the problems that they have. How will regular insulin help your patient who has these laboratory values? See, this is the part of Next Gen that you have to take it a step further. So not only is it being able to identify issues, identify medical emergencies, but you also have to be able to anticipate the treatment as the nurse, because you're going to give the medication. The doctor's not going to give it. The respiratory therapist not going to give this medication. So you can't pass it off to anybody else. You're responsible for it. So we know that regular insulin can lower potassium levels. Yeah. And so sometimes they'll give it to patients who are not diabetic. ReMar Nurse University starts tomorrow night, Monday, 8 p.m. Eastern Standard Time. Make sure that you're there. This is how you prepare for Next Gen NCLEX. It's about focusing on the clinical components of nursing based off the content that you've studied in a review. Okay? Show up for class. We have much more of this to go. Monday, May 29th at 8 p.m. Eastern Time. I want to see you in class later.